Hi everyone, welcome back to my YouTube channel and today we are going to talk about masseter muscle. So let's start our topic with introduction. Masseter is one of the primary muscle of mastication. It is a thick, quadrilateral and powerful muscle that is located in the cheek region. It plays a key role in elevating the mandible to close the mouth and making it essential for chewing. Origin of masseter muscle. Masseter muscle has two parts. It has superficial part that originate from maxillary process of zygomatic bone and anterior two-thirds of lower border of zygomatic arch. And it has deep part that originate from posterior third of a lower border and the entire medial surface of zygomatic arch. Insertion of masseter muscle. Both parts insert on the lateral surface of ramus and angle of the mandible. Superficial part insert into the lower half of the ramus, while deep part insert into the upper half of the ramus and coronary process. Nerve supply of masseter muscle. It is supplied by masseteric nerve, that is branch of mandibular division of trigeminal nerve. Blood supply of masseter muscle. It is by masseteric branch of maxillary artery and transverse facial artery, that is branch of superficial temporal artery. Actions of masseter muscle. First action is elevation of mandible, that as it is primary muscle for closing the mouth and biting. Second action is protrusion of mandible, as superficial fiber assists in protruding the mandible. And third function is stabilization, as this muscle helps maintain the position of mandible during mastication. Relations of masseter muscles. Superficial to this muscle are skin, fascia, and parotid gland. Teeth to this muscle are ramus of mandible, masseteric nerve, and maxillary vessels. Functional importance of masseter muscle. Masseter muscle provides great masticatory power. It is one of the strongest muscles in human body in relation to its size. It works in coordination with temporalis muscle, medial pterygoid muscle, and lateral pterygoid muscle for smooth jaw movement. Clinical significance of masseter muscle. First is masseteric hypertrophy. Enlargement of masseter muscle, often from bruxism or frequent chewing, cause facial asymmetry. Second significance is trismus or lockjaw. It is because of spasm of masseter muscle due to tetanus or trauma, and it leads to difficulty in opening the mouth. Third significance is TMJ disorder. It is because of overuse or imbalance in masseter activity that can cause jaw pain or TMJ dysfunction. Fourth is dental procedure. It is knowledge of its anatomy is important during mandibular nerve blocks. Conclusion of this lecture video. Masseter muscle is a key masticatory muscle that provides significant bite strength. It is supplied by mandibular nerve, that is branch of trigeminal nerve. It plays a vital role in chewing and jaw stabilization. Its anatomical location and strength make it clinically important in dentistry, maxillofacial surgery, and neurology. And this was all about masseter muscle. Hopefully you liked the video. If you do, don't forget to like, share, subscribe, and comment. Thank you for watching.